Hey everybody, hope you've enjoyed part one of the podcast. Now we've got part two coming up, so enjoy right after the usual stuff coming up right now. Hi, welcome to the Women's Health Podcast. I'm Anthony Lowe, the Physio Detective.
And I'm Marika Hart from Herasphere. Together we interview leading authorities, we answer questions and share our thoughts to provide the general public with the best quality information that we can find on all aspects of women's health. Please remember that the materials and the content on this podcast are intended as general information and they're for entertainment purposes only.
They're not intended to be a substitute for professional medical advice, diagnosis or treatment. Now sit back, grab your favourite beverage or do your thing and enjoy the show. There's so much gold, I'm sure that we could just go over this podcast and then pull out another 10 podcasts. Like, it's just so much in there. Fantastic stuff. But what I'm hearing is that the management of bladder pain syndrome, whilst there's lots of important things to know about the technical details, of which I just don't know very much at all, the management is still like that of other pain problems, and the phenotyping you were saying of the psychosocial components. So in other words, working out which of the dials which affects their autonomic nervous system is contributing a lot to how much suffering they're experiencing. Would that be right?
Yeah, this isn't rocket science. You know, I'm a nerd and I'm really interested in pain, and I've got my teeth into this area and I'm really interested in it, but it isn't rocket science. And this is what I say to patients. You know, you have everything within you to be able to heal this and move forward and change things. The physio's role is coach, as it should be in all pain states, in any situation really. And it's different for everyone, and you treat the patient in front of you. You know, don't be afraid to do anything with them. There isn't, you know, my protocol and my research is completely outdated and somewhat wrong now. I still, you know, you can still go by and do that intervention every week for 6 weeks with manual work and that kind of thing. And it really does help. But there's so much more that we can do, and it doesn't have to be cookie cutter. So I have plenty of patients, as I said, that are getting back to CrossFit and are doing box jumps and loading really hard and getting exercise and things like that. You work with your patient in front of you to find ways in to get to their nervous system and ways that you can talk to their nervous system. And sometimes that's hands-on, and that's a gentle massage to their bottom, or it's a getting them to do some mindfulness or qigong, and sometimes it's CrossFit and whatever you need to be doing. So it's not rocket science. As a physio, you have these skills, you have these innate skills in being able to look at how do we desensitize? How do we? There's a good, what's it called? Calm. I'm going to be very polite. Calm stuff down and then build stuff back up. But we all know there's a.
You can swear, that's fine.
Okay, fine. No, I'm not going to. It's fine. But that's what we should be doing. Yeah, there's no hard, nothing lost in building people back up in this problem with any kind of pain state, and actually giving people the confidence to get back to doing these things is the way forward. And I think this comes a lot from my own journey, that none of it's rocket science, but after open heart surgery I had rehab. I like to tell people I've been to rehab, and it was learning how to punch invisible ghosts very slowly, and it did nothing for me. I wouldn't have been able to have more than a 10-meter walking capacity forever if I'd followed that rehab. But what I did is have some really brave people around me that helped coach me into, what about if you lift this heavy thing up? I know you've been told not to do push-ups, but what about if we just try a mini one against a wall? And, you know, it builds up and builds up and builds up, and you end up with a body that functions and does the things that you want it to do. So we've got to be those cheerleaders as physios, and it isn't rocket science. You don't need to know all the technical details. I think they're really interesting, but that's me. Just go with your gut, treat your patient in front of you, and know that nothing that you do is going to be wrong as long as you are sub-threat with that person at all times. And the way that you treat them is going to be completely different to me. And that's brilliant, because what we don't want is everyone doing the same thing. If everyone was doing the same thing, no one would get better, because patients are different and they need to find someone that chimes in with them and is on the same wavelength as them, and they might need to try 2 or 3 different physios, and that's fine, but we all need to be doing different things and then sharing and collaborating on the things we're doing. I do a lot of weird stuff with PowerPoint presentations and images. I'm playing around. Me and Katie Kelly in Canada I think she's halfway into a PhD, but she's validated the first stage, looking at whether people respond to images differently if they have vulvodynia. And I'm not going to tell you the answers because it's hers to talk about, but I'm hoping she's going to publish soon. And I do lots of stuff around that. And a lot of people that I teach on the courses are just like, yeah, I can't get my head around that. I'm just going to get them moving. We're going to do some Pilates. I'm like, great, fantastic.
Yeah.
I think it's really lovely what you're talking about, the nervous system and how we get all these changes centrally, and how your body's basically, it's trying to be really efficient by laying down new pathways and changing things in the brain so that you can get those pain messages even more easily and more efficiently. But then on the flip side of that, that actually means that we can make changes in the reverse, which is what you're saying, because our brain is plastic. Our central nervous system has so much capacity to change. And I think that's a lovely message to receive, because I feel what I'm hearing from you, a little running joke, Anthony, but what I'm hearing from you, Jilly, is a lot about hope. It's a lot about the fact that we can actually go in there and try something and do something to change what's happening in that nervous system. And like you said, there's probably not too much that we can do wrong unless we go in and start poking that bear, creating more bears. But yeah, that was a really lovely message of hope there. So thank you. And it sounds like, because so much of that is coming from the addressing things in a biopsychosocial model, it sounds like there's a lot that can be done via telehealth, which is a nice little segue.
Yeah, definitely.
Now, right?
Yeah. And I've been doing telehealth for a while with patients that are too far away to get to clinic, or it's too much for them to sit in the car for hours. And always found it works. But this week, having flipped completely to a virtual clinic, it's working beautifully. You do the same stuff. You have to make an effort to make a connection with a patient. I think that's really important. That part of the course, I talk about how to make connections with humans. Some people don't get that. And they need a few tips. So it's about using your expressions. So I'll take my glasses off. Oh, can I see? I'm getting old, I tell you. Can't see anything. It's when you go into clinic, making sure that you use gestures that show I have no weapons. So I'm spreading my arms, showing you the center of me has no weapons. It's a quick psychological cue to ramp down the nervous system and make you feel approachable immediately. You show happiness and excitement in your face by raising your eyebrows and giving them a smile, even if you're just feeling like, oh, it's 7:30 and I don't want to be here. You use these physical cues to use body language passively or actively in a way that gets engagement really quickly. I do it with every single patient. Really sorry if there are patients listening, but I do this with every patient just to try and get high engagement. And making sure that you're looking at them as well. So in telehealth, one of those things, my video, my camera is actually at the bottom of my screen. So I haven't looked at either of you for the last hour, I'm afraid. All I do is I look at the dot. I can kind of see you in my peripheral vision, but it's much more important than when you're talking to someone online that you get eye contact or they feel that you're listening. It can be challenging sometimes with taking notes at the same time, because you need to make sure you're taking those notes. I have to put my glasses back on. And glasses can be a barrier. This is why I take them off. They can be a barrier to communication non-verbally. Right, typing notes is difficult. So I always ask before, and it's like about asking permission, is it okay if I take some notes at the same time? I am really paying attention. You just might see my fingers moving because I'm typing away, and this is what it looks like when I type. Yeah, you can see it completely covers up my camera. So those kind of considerations, they're the similar things that everyone does in clinic to make the day go easier. And we all know that we do them. You've got to get that patient on side in the first 10 seconds. If they feel that they are trusted, that they are listened to, they're going to be much more able to open up to you, especially on telehealth. And it doesn't matter what they're doing. It doesn't matter if their phone is facing the ceiling, if it's facing their face. You pay attention in that screen. and you make sure that you, at least for the first minute or two, I always say, put your pen down. No typing, just listening. That's a really key thing. And then also, again, about getting engagement really quickly, a coaching skill. Don't interrupt them. Listen to everything they say, tell their whole story, and then at the end, review that. And I know this is something that Auntie and I were practicing on Caroline's course together, which is really fun. And it's a really good skill to have. Being on average, I think the data shows, and Virginia Rivers Bulkley will, who's my co-teaching buddy and awesome, she'll probably tell me off this. I can't remember what it is. I think it's about 7 seconds that on average we jump in after 7 seconds of someone saying, well, I had this pain and it's that, and you go, oh, can you tell me what did they diagnose? What? Just listen to them, let them finish. On average, they will do between 2 and 5 minutes. There's something less than 20% of people talk for more than 5 minutes. But at the end of that, you then say to them, so I just want to tell you, kind of summarize what you just told me, just to make sure I've got this right. And then you summarize it, and you can summarize it in any which way you want, but make sure you use some of their language. So, and then this stabbing pain up through your side that kind of pushed all your organs came on, and then you saw the doctor, and then this happened. As a physio, we might be able to say, and then you had your flank pain, this pain in the side happened. No, use their words, this stabbing pain that pushed that your organs came on, that kind of thing. That again gets engagement quicker. So that's some tips that I'm finding from a telehealth perspective that's really important to get the engagement. But if you can work hard at that in the first 5 minutes, you'll have a fine session, the same as if they're in the same space as you, because you just got to make people feel that you're really truly interested and you're with them in that journey and with them in that moment and care. And that can be faked. But it's easy to it's easy to kind of learn how to do that.
Absolutely. I'm just practicing now looking at the green dot on my screen so that it feels like I'm speaking to you, because ordinarily I'll just look at you over here like this.
Yeah.
But now you're up here.
I know, it's slightly scary. You're looking at me in the face. I'm going to take my and look at you in the face.
That's really creepy, Anthony.
Yeah.
Why? What? Are you not used to me looking at you right in the eyes? Just recently, just to illustrate a lot of what you're saying is ringing so true. For instance, just recently I had a lady come in, and because of the recent situation, I just had the time. It's an old friend, and she came in, and she's here for a diastasis checkup like 3 months after the last time I saw her, okay? So we're talking ages away. And she sat down and she felt like a bubble of energy about to burst. So, how are you going? Tell me what's been going on. And then it all came out. So a half an hour session, and I did only charge her half an hour. An hour and 20 of that session was spent just listening and talking about everything that she was going through. And the only reason why it went that long is that I felt like it would be wrong for me to cut her short before she'd settled down. Like, she was simmering the whole time. The whole time. And it took an hour and 20. Like, it's like, what is happening to people with social isolation? People working at home together. Like, I've heard some funny stories about people working at home together for the first time. One person was like, one husband was like, it's interesting hearing you on the phone. You're actually nice to people on the phone. Because his experience has only been getting in trouble. It's quite funny. But yeah, so it took literally 10 minutes to check where she was up to. She was going great. She'd been doing the exercise, not enough of the exercises, but otherwise she'd been doing really well. So I felt really grateful that I had the time to be able to spend that time with her doing that. But holy moly, like I take the therapist part of being a physiotherapist seriously, a lot more seriously in this latter half of my career. Um, but one of the things that we did actually talk about was that, um, I have a certain skill set, which means that I don't take on her burden and her responsibilities the same way that she actually does. That was part of the conversation, is that she feels the burden of responsibility for many, many things. In what ways have you found, um, taking care of yourself and burnout, and like you alluded to it earlier, you work in pelvic health, there's higher ACEs, there's higher instances of humans doing not very nice things to each other. Um, if you're happy to talk about a little bit of how you
Yeah,
protect
sure.
yourself about that.
What can happen? Yeah, so I think we've talked a lot about the psychosocial element of treatment already, and I think it's really important, just as a little thing to highlight, is that I do have a really good team. So when I talk about picking up all of these psychological factors, I'm not trying to treat them all myself. I'm sending them to the psychologist, the psychotherapist, the counsellor. I've got a fantastic, what does she call herself? Hypnotherapist, who's an ex-nurse and is really good at listening and counselling people. So I've got a huge team of psychosocial services around me that I can refer people to, which helps with not burdening yourself. I think it's been a challenging period of growth, probably over the last 5 years, as I've taken more responsibility on as a team leader and as a teacher and things like that. And certainly with a certain degree of social media presence, you get sent more crazy patients. And as I keep telling people, I am a physio. I am just a physio, and the just is not there to diminish it. I am the same as everyone else. I'm just got a social media presence. So yesterday, I was doing some good social contact online with my friend Biliana, who you know as well, Anthony, in Switzerland, who's also in lockdown with her kids, and telling her about the three patients that I had, who were all incredibly complex, and sent to me by other people, quite challenging. Now, I think back in the day, there was a point as a baby physio where I was in pelvic pain clinic, which ran once a month and was basically rape and abuse clinic. And you would see 4 patients in an afternoon with the consultants, gynecologist, anaesthetist, psychologist, and any other trainees that are in there, with 1 patient for an hour and a half at a time. And then you would take those 4 patients on. And that was only once a month to limit the exposure to the clinician, so you're not doing too much heavy work. But over a period of 3 months, I covered that clinic myself only. And so I ended up with at least 12, if not 15, 16 patients. And one Monday, I think I had about 8 hours back to back of really quite difficult work, hard work. And I remember kind of smacking my head against the table, crying, going, I can't do this anymore. I'm just going to hate all men and not be able to do this. And you can get to that point. But what I think I've learned a few things that help, because until about 18 months ago, maybe 2 years ago, I can do 8 hours a day of pelvic pain absolutely fine. I love it. I relish it. I thrive on it. It fuels me now, as opposed to being diminishing. And the things I learned were, one, that you need to take the responsibility for healing someone off yourself. And with telehealth, that's a key thing as well, that a lot of physios are really getting worried now, but I can't do things for patients. I'm not going to be able to do my physio. But I hate to tell them, but their physio is 80% the patient seeing them, being reassured. You know, I've had quite a few heart attacks, and my therapy comes in many ways, but my personal trainer is amazing. He will, when I've come back from a heart attack and gone back into the gym, he knows that the first 3-4 weeks is me just being in a gym space. That's important. And he gets he'll get the what's it called? The lifesaver. Anyway, get the electrical box out, put it next to me, and then get me to lift. Gets the defib, puts it next to me and gets me to lift like 2K 5 times and do 5 squats, and makes me dad dance between every exercise, which is what I'm continuing to do from home in my garage. And we just have a chat and we catch up. I go away, and over the weeks it gets better. That's what physio is as well. It's the therapy type of it. So when you're doing physio, you don't take on the responsibility for getting that person better. And I think the the sessions in which you feel depleted, when I've come away from them and reflected on them, it's the ones where I feel responsible for that person's pain. And we need to get rid of that, because that is a very passive situation for you to be in with that patient. You shouldn't be providing treatment that changes them. You can be giving them opportunities and a window into exploring new movement, new experiences within their body, but coaching them how to keep progressing that. And it's, again, coming back to these coaching skills, in that you are there as a facilitator, not as a producer of change. And the change can only come from the patient. It's also a level of arrogance from a physio point of view to say, like, I am responsible for I am going to get you better. I can, I use a lot of language with patients saying, I'm not concerned by what you're telling me. This is something I've seen many times before and we've been able to change, but it's always a we, and this is a collaboration. Take that pressure off yourself. Take that pedestal that you stand on away and stand next to the patient and walk with them as they get better, and walk with them as they make change. So that's one. And certainly the moments where I felt, and that's with everything, with prolapses, if prolapses aren't getting better and they're really struggling, you can come away from those sessions feeling depleted and sad that you haven't done as good as you should have. But the reality is, actually, you're seeing them for 22.5 minutes, 30 minutes once a week, or once every 6 weeks. They're in their body 23.5 hours of that day. And actually your job is to give them the knowledge and experience and options for them to be able to make the choices and the changes in their body. You can't do that for them. And it's arrogant to think that you can. So take that pressure off you. And the second is to have good outlets, and good outlets that build up your emotional resilience. And I got really good at that for many years. And I think I did 10 years really well. And one of the things that my friend Jazz Ampaw, which if you are lacking, if you're feeling a bit low at the moment, go find Jazz Ampaw, AMPAW-FARR. Go find her on Facebook, watch some of her videos, and she will brighten your life. She's got an amazing TED lecture. She's an incredible human being. She talks about your bucket. So in physio, we know this terminology about filling your bucket up, but she talks about it as a cup and saucer. And she says, right, so you fill your cup with love, seeing family, reading books, doing things that makes you feel good, makes your soul feel full, all that kind of stuff. And we all think that when our cup's full, then we can give to other people a little bit. And she says, no, that is wrong. That's where everyone goes wrong, because then their bucket depletes. What you do is you fill up your cup until the tea, the Earl Grey decaf, is pouring over the sides into the saucer. And until you fill the saucer up, you fill yourself with so much good stuff that you are so full of good emotions and stable and happy that your saucer is full. And then you let people sip from the saucers and you don't let them have your cup. And if your cup is not full enough, you've got nothing to give from your saucer. Now, last July, my dad passed away. And for the 18 months before that, we had pretty ridiculous period of time. It wasn't 8, it was less than that. It was 11 months from his diagnosis to his passing, his death. And it was a really tough period of time. I was living between Cardiff, which is in Wales, and London, where my family were, and commuting back and forth, spending 4 days in one place, 3 days in the other, not having any downtime, trying to do both things at once. So when I was in London, I'd be catching up on work emails and things from running my business. And when I was in Cardiff, I'd be making sure, texting that my dad's oxygen stats that day were okay, and discussing with mum what blood filtration is. All this kind of stuff. It was a huge emotional load, and my cup was dry. And not only was that, I managed to fill my time trying to fill my cup with research and work, because work is a good distraction, and also I'm a bit of a nerd and I love it. So I spoke at 10 conferences and taught 5 courses over the course of that year. And it was too much, and my cup was absolutely dry. And in May, the month before he died, I just completely burnt out. And burnout is not what you think it is. It's not what I thought it was. I just stopped functioning. I stopped caring, and that's not me. And it was a really challenging period of time, really, really challenging. And after I'd taken a period of time off, I came back, and I was actually talking to Anthony, who's a fantastic big brother to have across the seas, about it a while ago, because it didn't really get better. I was analytically better, and the grief is easing. It's still early days, but I'm functioning now. But I was finding that my interactions with patients were too emotionally sapping. And I know that's not me when I'm, in my athletic level of physio at best, that I am present. I sit with the vulnerability. I take myself back to, you got to kind of, I take this moment to have a breath and take myself to my baseline, and sit there in vulnerability with someone with an open mind and open heart to listen with them and be with them, and not try and be responsible for things. But it became too difficult. So I made the decision about 6 weeks ago, having struggled for a while, to cut down my clinical caseload, so that for the patients I am there with, I can really be present with. And that's working great. And I feel like I'm flying again. So I think, and it was a really, really hard decision to make, because I've worked 4.5 days clinically and 4 days on my own business full time. And I know that does not make 7, which is partly the problem, for a long time, and being able to do that. But there are times where you have to make the hard decisions, and I love clinical practice, and I never want to leave it. And so to not leave it, I have to significantly reduce it down. So I do kind of 4 hours twice a week at the moment, and then the rest of the time I'm working on my teaching and development. And I'll do that for a while, until we can just about scrape by at the moment. We're all in crisis, but I'll do that for a while until I feel like it's not a burden, because the processes that I would usually employ, they aren't enough. So I don't feel responsible for people's healing. I enjoy helping them on their journey to healing. I'm very much in that mindset, but that isn't enough. I can still feel depleted if I see too many patients in significant distress. There's also a psychological technique that in coaching you learn, that sometimes if you feel yourself getting tense, you almost imagine a force field or a barrier, and you put the barrier up, and just for a split second, stop listening to what they say, imagine the barrier, take a breath in yourself, remember your own feelings of your body. So sitting, the feeling of your pressure of your bottom against the chair and that kind of thing. Be aware of your own sensations, take a breath. And I used to find that, especially with really difficult stories and really difficult situations where I knew I had to go back into a patient, and I wouldn't ask them for details, but you've got to be present if they share them, and you've got a legal responsibility to then do something about it a lot of the time. But in those situations, doing that kind of psychological process of giving yourself a barrier to the words that they're saying can be really helpful. And that helped for a long time, and that meant I could do 8 hours a day of really quite terrible traumatic work and feel like I'd done a great job and feel fueled by it at the end of the day. And again, at the moment, that's not working. So I just have to do little bits of it. My saucer goes very quickly. It used to last 8 hours. It lasts about 4 hours, but I need to make sure my cup is always full, else I'm going to go back into being really sad and stressed, which is where I'm at the moment.
That's really hard, Jilly. That's really hard. And it's difficult, like what you were saying. It's really hard because of the current COVID situation and your usual support structure around you, with your husband, is really, really difficult. So that's hard to hear as a friend from across the seas.
Thanks. It's getting a lot better though. It is. It certainly works, and I think we as physios, we get into the profession because we really want to help, and your default setting is to give. And when you're feeling bad, I think my default is to give more. So I'm, sat at home idly thinking, I should go and volunteer to go back in the NHS. And then I have to keep reminding myself that's probably certain death for me. So your preset when you feel low is to give, and actually taking that time and having wonderful mentorship and support from lots of colleagues around the world, including you, thank you very much, has been really, really helpful. reaching out to people is really useful. But I'm feeling much better for it. Having made the decision, I'm a lot happier because I can give in different ways, and I'm focusing on providing as much professional development for free and providing as much information as I can at this time to support physios, because that's what I can do, and I can do without depleting my saucer too much.
Anything we can do to help fill your cup and to help let your saucer overflow so that you can continue giving. We would
Have more places to clean.
Yeah, we would love to help you. We're looking forward to. I've got the daunting task of summarising what we've covered over the last hour and a half. So, let's see. You're amazing. I think that's a fair point. That's a fair way to start the summary. You're amazing. Absolutely love listening to you and love chatting to you as we have done. So really have enjoyed this time with you so far. So thank you very much for generously giving us your time.
Well, thank you for having me. This has filled my cup. It's really lovely to connect with clinicians that are as passionate about serving as I am, and it does fill my cup.
Yeah, and it's in this time it's quite stressful. I know I'm feeling the stress. I know Marika's feeling tired. You're feeling quite low, understandably so. And many others, Marika and I hear from other people as well about just what's going on, and there's a lot of stress and distress out there. With the happy bladders, the bladder pain syndrome, and the slab classification of it, as well as identifying the sad cliffs, as per Carolyn's mnemonic, being able to really see and listen to a person, not just a body part. Not even, using that information that you gain from the subjective, and now you're, all telehealth, because literally it's life-threatening for you if you get sick. you know, Being able to use that to determine when you're going to do a physical examination, even being able to help people without touching them. And, you were telling us off the air that it's possible, it can be done. I'm hearing, I got a few messages already. Hey, I did some telehealth stuff and it's amazing. Like, you're right, it can be done. And so, hearing lots of that from you, knowing the nerdy stuff, as you call it. I'm a nerd. Marika's a bit of a nerd, but she's much more of a kick-ass nerd. Literally kicking ass. um, um,
That
you
was
know,
just a bad taekwondo joke, Jilly.
That was a bad taekwondo joke. Yeah, no, you are an absolute badass. I've seen the photos.
I don't know. I'm too old for that stuff now. I can't even get my leg up that high.
Oh, I'm sure. A little bit
I'll
of practice.
kick you in the guts. I can't kick you in the head. That's fine.
Oh, that's a shame. I'm very glad.
So having that ability to work out is super important, and seeing the person, listening to their story, the coaching skills that you've gone and studied, the ability to be able to work with super complex cases, sift through that information, really, really reinforcing that point that when they come and see you, it's your skill at distilling all the information. It's our skill at distilling that information, which really makes us good therapists. Being able to, to recognize, because you were involved in the research, which even those protocols you say is now out of date will still work, but you've evolved into something even better. Knowing from the research that the improvement is going to be there, the subjective reporting doesn't always match the tracking of the outcome measures that you've used. And so it sounds like the outcome measures, not just of objective data, or the patient's reporting, but also the outcome measures that we talked about from SAD-CLIFs, stress, anxiety, depression. So that was all good. And, the word that sticks in my mind was, Carolyn's course was a game changer for you, for example. And so just hearing that evolution into a biopsychosocial, almost super aware state, just realizing just how important it all ties together. And then we shifted gears into, well, there was burnout, which was just the last little bit. And thank you for sharing, excuse me, thank you for sharing your personal story and, you know, just how difficult it was. And having heard it before, it's still hard to hear just how difficult it was and how run down you got. And I think I told you, I got pretty low as well last year for different reasons. And so, poor Marika heard all about that too. So yeah, it's been really, really good.
2019 was the sucky year and 2020 was going to be awesome.
Yeah.
I will share
That was
with
my
you.
plan.
I will share with you privately a video that is absolutely hilarious. This guy saying, "I'm sorry, 2019. I'm sorry I said all those things about you. I want you back." Like, who pissed off 2020? Who pissed her off? You can
I've
have
seen
a...
like people saying they want a reboot, they want a refund on their 2020.
Yes.
Turn it back on again and see if we can all restart it.
Yeah. Hey,
So,
Jilly, thank you. Oh, sorry, Anthony, were you still?
well, I was going to say I think that's the recap, but I'm not sure.
I think that was a very awesome, very thorough recap. I am. You can tell I'm a bit brain dead. I'm like really tired. I'm so tired, and I've so enjoyed that, Jilly, and I've had to really focus because I feel like you have just so much knowledge, and I know that I'm going to go and listen to this podcast at least 2 more times. I actually do listen to our podcast, even though I hate the sound of my own voice. I love going back because we just have such amazing guests, and I learn so much from talking to amazing clinicians. And I know that, oh my gosh, so I work with Judith Thompson and like the Body Logic crew, and they are big fangirls of you, and they're so excited that we're having I'm talking to you today. So I know that they are going to be, thrilled to hear this, but people all over the world are going to get so much out of this. So we are incredibly grateful for you spending, we've been together for almost 2 hours now. So I just want to say thank you so much. And I hope we haven't exhausted you. I hope we have filled your cup. But we really appreciate all that you do and all that you share, and your whole attitude towards, and that generosity that you have towards our profession. And, Anthony and I we're talking about this, and that's one of the reasons why we're just cranking out quite a few podcasts at the moment. And, it's just that we want to be there for our community and support one another. And, it's not too much energy and time for us, but it is something that we can give. And we know that we're very, very great. We're very fortunate that we can send people messages and say, hey, do you want to have a chat to us about this? And, 99% of the time they say, yep, when can you do it? And yeah, thank you. It's very much appreciated.
It's been my absolute pleasure. It's really lovely to talk to both of you, and I think you are providing such an invaluable service, getting, curating all of this incredible information from around the world. So yeah, I'm a big fan, and I listen to the podcasts too. You get it, it's amazing that we have such a diverse range of free CPD that we can all do, professional development stuff. But especially at the time when people are going to have no money. I'm self-employed, so I have no job for 3 months now. But I have toilet roll, so it doesn't matter.
I got my bum gun the other day, like yesterday. I got my The bidet hose.
Oh.
Yeah.
Oh. Okay.
Yeah.
Yeah. No, we're not there yet. I don't know if I can accept that. I'll do a shower before I'll do a bidet. It's a bit weird. But yeah, it's one of those things. I think the community are responding amazingly. Like there were so many telehealth conversations going on this week. We had a chat on the UK membership group of our national body. People kind of scrambling, trying to find out how to do telehealth. And I put up a video to try and help congregate everyone so they could have the information in one place. And from that, we've had Jessica Drummond, we've had Karen Litzy, all these fab international physios that have done webinars and things about how to produce things. So people are really trying to help each other, and that's just such a great spirit. And I don't want to compare it to the war, because wartime is a very different time to now, but we're certainly all coming together. And that's this amazing thing of this community that I've always felt warm and supported by. So last year, really at my lowest points, when I'm lucky enough to speak to quite a few of the international people like you guys, and I was getting so many private messages of support from people, kind of going, step away from social media, it will be there in 6 months, the conversation will not have changed, don't worry, and this is what you need to do. And that was incredible. So yeah, keep doing what you're doing, because this support internationally really, really helps everyone to feel a bit better. So a massive hug to everyone that's listening to this. We are going to get through this. It's going to be okay. And if you're treating pelvic pain, you can make it better. There's no reason. We are continually evolving, and we have such a beautiful profession. It's within our scope to look at these things and work with a human. So, be a good human, do what you can, don't put yourself at risk, but we are going to get through this.
Absolutely. Really appreciate it, Jilly. Where can people find you, your contact details? We'll make sure that we get those details from you. I forgot to send you the form. That's my fault. But where can people find you?
I'm on jillybond.com, which is JILLYBOND, as in a Bond girl.com, not Gilly the goldfish. I'm at Jilly_Bond on Twitter. I'm Jilly Bond Physio on Instagram, and I'm Jilly Bond Physiotherapy on Facebook. So you can find me everywhere. Yeah, I'm interested. If anyone wants to chat anytime, give me a shout. I'm not up to much these days, producing resources. So if you've got things you want to talk through, give me a shout.
We can't wait to see your online course, and we will be signing up for that.
It's coming.
We'll see it soon.
Beavering away. Yeah, that I'm hoping to have that up within the month. So there will be stuff going out soon, but within the month.
Excellent.
Fantastic, Jilly. Thank you very much. And to all you listeners out there, I hope you've enjoyed it. And please reach out to Jilly. Send her your gratitude, your thanks, your support. We can all use...
not just your tricky patients.
Yeah, not just your tricky patients. Not just your tricky questions. But yeah... And if you are struggling, if you are wanting to have a chat with me, definitely on the messenger thing is a lot easier. Having face-to-face chats is really difficult at the moment for me, but loving it and loving the connections. Thank you very much, and we'll speak to you later. See?
Bye.
Well, that's it for this episode. Be sure to hit like if you enjoyed the episode, and leave any comments or questions below. We'd really like to hear from you.
If you haven't already hit subscribe, please do so now so that you can be kept notified when we release our next episode.
Otherwise, thank you for listening, and we look forward to having you back with us for another episode of the Women's Health Podcast.